Hi everyone, welcome back to my video series on cognitive behavioral therapy. Today we will be talking about the theoretical foundations of CBT. So CBT is rooted in two major psychological traditions, cognitive theory and behavioral theory. These frameworks provide the foundation for how thoughts, emotions, and behaviors interact and how they can be modified for therapeutic change. CBT is evidence-based, meaning it has been tested in research and clinical practice for decades. It was originally developed by Aaron Beck in the 1960s as a treatment for depression, but has since been expanded to treat anxiety, PTSD, substance abuse, and more. Today we will explore the cognitive and behavioral foundations of CBT, the cognitive behavior model, and the CBT triangle. First, we will dive into the cognitive theory, Beck's model of cognition. Cognitive theory was developed by Aaron Beck, states that our thoughts influence our emotions and behaviors. Negative thinking patterns can lead to distress and maladaptive behaviors. Some key concepts in this theory include automatic thoughts, the quick reflective thoughts that pop into our minds, such as I'm a failure, cognitive distortions, systematic errors in thinking, such as catastrophizing or all or nothing thinking, or core beliefs, deeply held beliefs about ourselves, others, and the world, often formed in childhood. An example of this could be a person with social anxiety might have the automatic thought, everyone thinks I'm awkward. They would feel anxious, then they avoid socializing, which then reinforces the belief. CBT helps challenge these negative thoughts and then replaces them with a more balanced perspectives. The goal of cognitive theory, all in all, is to recognize and challenge those cognitive distortions. Behavioral theory next is more going into learning and conditioning. So CBT also draws from behavioral psychology, which focuses on how behaviors are learned and maintained. The two key principles are classical condition and operant condition. Classical condition, Pavlov in 1900s, was learning through association. So an example could be a child bitten by a dog may develop a phobia of dogs due to fear conditioning. Operant condition, Skinner 1950s, where we learned through rewards and punishment. So an example would be a person with social anxiety avoids social situations they feel relieved, so avoidance would be reinforced. CBT uses behavioral interventions such as exposure therapy, behavioral activation to break these maladaptive behavior patterns. And then together, we have the cognitive behavior model, which integrates both these principles and explaining how the thoughts, emotions, and behaviors interact in a continuous loop. The CBT cycle, so we have, and we can see here with the, the CBT triangle, is how it's a cycle of thoughts, which influence emotions, behaviors, emotions, which affects thinking and decision making, and then behaviors, which reinforce or challenge existing thoughts. So, for example, a student fails a test. They think, I'm stupid. They may feel sad and hopeless. They avoid studying. They'll fail again, which then reinforces this belief of, I'm stupid. The CBT triangle is a visual representation of how thoughts, emotions, and behaviors are interconnected. Thoughts, the interpretations we make about a situation. Feelings, the emotions that result from our thoughts. And in behaviors, the actions we take based on our emotions and thoughts. An example of this could be, once again, in social anxiety. The thought of, I'll embarrass myself if I speak in class. That feeling of anxiety and fear. Their behavior, they may avoid participation, which then reinforces anxiety. CBT helps clients change their thoughts and behaviors to improve emotional well-being. So, you may ask, how could I use this model? So, CBT sessions focuses on identifying challenging and restructuring negative thoughts while using behavioral techniques to reinforce positive change. So, some CBT techniques based on these theories, we have cognitive restructuring, which is identifying and changing the negative thought patterns, behavior activation, encouraging engagement in positive activities, exposure therapy, gradual exposure to feared situation, and Socratic questioning, guiding clients to challenge irrational beliefs. There will be later videos going more in depth about these, but applying these methods, clients can break the cycle of negative thinking and avoidance. So, in conclusion, understanding CBT's theoretical foundations is essential for effective practice. The cognitive behavior model and the CBT triangle explain how psychological distress develops and how therapy intervenes at multiple levels. Some key takeaways from this presentation could be that cognitive theory, thoughts shape emotion and behaviors, and how behavioral theory, learning and reinforcement, influence actions, and come together for the CBT triangle to show the interplay of thoughts, feelings, and behaviors. And by modifying thoughts and behaviors, CBT can help clients create a long-term positive change in their mental health. In the next video, we will explore how a typical CBT session is structured. Thank you.